Consumers are demanding the most convenient and easy experience for them when also considering pricing and quality. So we want to try and tap into all those elements when we're communicating to a potential or an existing patient.
That was the voice of Tanner Fritz, the Chief Technology Officer at Sona Dermatology and MedSpa. Tanner shared how his company is using technology to analyze the patient experience and create the best customer service possible in the healthcare space. You're listening to How I Transformed This, presented by Versus 12. Versus 12 is the award-winning Salesforce Gold consulting partner focused on healthcare innovation nationwide. In this episode, Tanner describes Sona MedSpa's focus on bringing its retail experience into the healthcare space, which allows the company to provide excellent service and convenience for patients. He also shares how Salesforce allowed Sona MedSpa to develop an application that uses real-time data to better engage with its clients.
Salesforce really took us from 0 to 60 in terms of our ability to scale out what I would say, again, is a best-in-class application and culture.
I'm your host, Clark Buckner, and along with Versus 12 founder and CEO Tammy Hawes, each episode we'll be seeking out healthcare technology industry leaders, exploring stories of success through the transformation of healthcare. For more stories like this, visit versus12.com/podcast. Now let's jump in.
Hello, my name is Tanner Fritz. I'm with Sona Dermatology and MedSpa, and I'm the Chief Technology Officer.
Excellent. Thank you so much for taking a few minutes to share with us your story. And this is the show, How I Transformed This. So it's really interesting to connect with a lot of friends of Tammy's and to hear what innovations that they're doing in this space. So Tammy, I'm so excited about today's episode.
Yes, and I'm excited about Tanner because he's going to come to this podcast and tell us things really from a technology standpoint that we probably haven't heard from some of the other guests. And as a client of Versus 12, Tanner's really doing some things that I think in 5 or 10 years from now may be standard, but they're definitely not standard now. So I'm excited to hear Tanner speak about that.
Tammy and I are both in the studio, and we've got Tanner joining us in remotely. So this is fun. You're our first guest. We're beaming in. So how about, Tanner, can you start us off with just kind of a past, present, future? We want to start with the past of how did you kind of find yourself in this work? What were you doing? What motivated you? And we'll kind of tiptoe to present day.
Yeah, that's great. Well, happy to be beamed in here. You know, my story in the past, I was kind of brought up in product and software startups and had a few runs in some software startups, which was phenomenal for me personally because I got to learn how to fail very quickly. But I also learned a lot about product and market fit and where there's opportunities. And on a more personal level, you asked about kind of how did I get to where I am now? Part of my story, and Tammy, I don't even think I told you this, is that I went through a bout of cancer about 6 years ago. So had my first ever real interaction with the healthcare space and started to have a new appreciation for all things healthcare. I was brought up and saw the opportunity with this group called Sona Dermatology and MedSpa. And as I started talking to this group, I realized very quickly that one of the main reasons they were interested in me was because I didn't have healthcare experience. I kind of came to this space with some fresh eyes and also came to this space with a little bit more entrepreneurial thinking and how are we going to problem solve a lot of these hurdles that exist within the heavily regulated healthcare space. So I've been now in the Sona group for almost 3 years and have really enjoyed leaps and bounds that we've been able to achieve over that time frame. So that's where I've come from in the past there.
So Tanner, I think that is fantastic. I think sometimes being in healthcare for a long time, I mean, I've been in healthcare IT for a long time. Sometimes you can't get outside of yourself because you know too much, you know, about how tough the path in the past has been. And I see that a lot where companies are bringing in people with fresh eyes, fresh perspectives. And it sounds like Sona hit a home run bringing you in.
Yeah, well, I think they did. I'm thankful to be here, but you're right. When I first started here, I think if you hadn't been in the healthcare space, you didn't realize some of the hurdles that are involved from an IT perspective. I was used to kind of going full throttle and then felt like I had an anchor I was dragging alongside me known as healthcare in terms of data access and API access and really closed systems and closed system environments. And that was one of my biggest eye-openers to being an outsider to the healthcare space, was that the ability to access your data and to move quickly was a big inhibitor, but also a really big opportunity to stand out if you could figure out how to do that. And so that's what we've been trying to do. But you're right. I think fresh eyes is something that can be super valuable to any organization that's in this space.
So you're integrating a lot of data and making decisions about the patient's journey based on that data. Could you share how that works?
Yeah, absolutely. So one of the unique things about Sona is we were traditionally more of a consumer-oriented retail group. We've got the dermatology and MedSpa sides of our business, and Sona having more of the history on the MedSpa side, we really were focused on a patient experience that was excellent in all regards. And that is on a sales and lead process all the way to an in-person, more consultative approach. And the actual treatments we provided and the follow-up, we were focused on delivering this excellent customer experience. As we moved into dermatology over the last 5 years, we've really been challenged with how do you translate what normally folks think of when they think about going to a doctor's office and continue to provide that excellent experience by analyzing the patient experience. So we've rolled out net promoter score surveys and have really tried to analyze all the way from somebody at the beginning, cradle to grave, when they first raise their hand and say they're interested in a product or service or seeing a physician, all the way to when they get a final bill from their insurance. How do we analyze each interaction and each customer experience point to try and optimize, find gaps, find room for improvement? So one of the ways we do that is through Net Promoter Score and analyzing all the different applications and touch points across our environment, our ecosystem.
I appreciate you sharing earlier about your journey with cancer, and I'm curious to hear how maybe your view on healthcare changed from before and after during that experience.
I guess first off, I had never truly understood what it meant to be cared for by a healthcare professional or entity, and in terms of really relying on them. And so I gained a huge appreciation for what I would call the hands and feet of healthcare, which is really the nursing staff and those types of folks who are doing a lot of the heavy lifting. And when I think about how that translates to the business now that I'm a part of, it gives me a higher appreciation for the folks that are juggling the challenges of healthcare, which is, hey, first and foremost, we're here to care for people and for the specific situations and scenarios they're going through, whether that be an elective service like some of our cosmetic services where somebody wants to look better and feel better about themselves, or if they have more of an issue that they need resolved. Think about something like psoriasis or eczema, which is a constant battle. When you think about the providers who are helping to treat these scenarios and services, they're juggling first and foremost care, and secondarily, the EHR challenges and data quality and systems and things that they really weren't initially trained for. And initially, I guess they didn't really sign up for that. If you think about physicians, they really signed up to care for people. So my personal experience has allowed me a little bit more perspective to understand, well, yeah, we really have to keep both these things in mind. We don't just want the system to be all ones and zeros. We want to figure out how do we care for the specific cases and specific individuals, both on the patient side and on our staff side. So we're trying to figure out always with a set of eyes that says, how do we get the best scenario from a systems perspective? But we've got to be malleable to be able to make adjustments based on the best optimal care for our patients and our staff. And that's a challenge. And that's something that we're constantly looking at when we look at new software and vendors and changes to our internal operations. So that's something that I hope to continually look at as we consider how we continually improve the operations.
So in my experience as being a patient, I've been served by some of the best healthcare practitioners in the business, but there's this what happens prior to the visit and what happens after the visit or the hospital stay or whatever that can sometimes taint the entire experience. So I think one of the things that I was very impressed with Sona is that you truly are managing that journey for that patient from the beginning to the end. So you don't really smear the reputation of your providers by just having bad administrative service, or when the patient leaves, there may be billing questions and that kind of thing. Can you speak to some of the innovative things and how difficult or easy it was to put those in place?
Yeah. I was fortunate to, when I started at Sona, to really have an executive team that understood the value of investing in technology. And so when I first came on board, Sona had also had a great disciplined sales and marketing team and operation going forward. So we had this wonderful lead management and prospecting procedure for anybody who's interested in our services. And I was really impressed with the documentation and the discipline that the team had. However, we just didn't have great tools. We were living a little bit in yesteryear. And so it was really a great situation for me personally to kind of inherit, to say, hey, we've got this great culture to treat our patients and our prospects and how we follow up with them. But we just need better tools. We need somebody who can bring us up to speed. And so we immediately looked at what are the best in class enterprise applications out there for the entire customer journey. And we identified 5 or 6 of them, and we started with Salesforce. We knew that we were going to need a tool like Salesforce to help us with an 80-person in-house sales staff. And we have 20 plus locations. So we're constantly interacting with our client base and our prospects and our leads. So Salesforce really took us from 0 to 60 in terms of our ability to scale out what I would say, again, is a best-in-class application and culture. So we started there, and then we initially realized part of our business thesis was, hey, we want to move from just being in the MedSpa space in the dermatology space. And that required us implementing a handful of other enterprise software applications from an EHR perspective, from claims management and submission, even to our scheduling and how we're going to collect on open billing. All of that relied on an integration strategy, and that had to be really well thought out. Tammy, we relied on your team heavily here and ended up choosing a platform called SnapLogic, which is one of these integration platforms as a service. And we're doing things in, quote, real time where, within a second or two, we're syncing Jane Doe across 4 or 5 systems. And if she doesn't sync, that's a problem for us operationally. So we had to really work through the business use cases on how the data is going to flow. And again, the concept here is that we're building out all the wiring and the plumbing so that we can have the excellent customer and patient experience when it comes to somebody who is trying to get the best for their skin. So we analyze all of our different staff members, whether that's somebody on the sales side, somebody at the front desk, provider or physician, or somebody back at our support center. And we ended up really being able to prove out our thesis and say, yeah, we can integrate this data in real time so that we can distinguish ourselves from the rest of the pack. And I think that's part of our competitive advantage, is that we've been willing to invest in this type of technology with definitely some risk, but knowing that if we can do it, we can definitely set ourselves apart to say, wow, we come from consumer-oriented retail, but we're swimming towards dermatology real fast. And we're going to keep kind of the ethos of who we are all together by being able to enable this data transfer.
So it's very interesting that you speak about the patient as a consumer. I think in healthcare, sometimes there are systems and providers that shy away from thinking about the patient as a consumer. But as a patient, I want that consumer experience that is rich, that is kind of a given with mobile technology and with all the things that you get in all the other industries. So it's actually really interesting that you came into this and Sona came into this from a consumer experience and then translated into the medical side of the house with dermatology.
Yeah, absolutely. I think that really, if you look at what's being demanded by consumers, whether you refer to them as patients or customers, consumers, the consumer is starting to demand just a higher level of access and convenience. And the healthcare organizations that adapt quickly are the ones I believe are going to win out when it comes to better brand recognition and more loyal patients. So we've tried to be very aggressive with testing out how do we lean into a more consumer-oriented experience. And that kind of translates or percolates up to experiences like online booking. How do we allow our patients to book services online? Even when in the MedSpa side of things, it's really hard to know, can we even see this patient and how many treatments are they looking for? And so we're looking at ways to extend access to patients. To your point, we live in a mobile world. And so somebody should be able to book an appointment and see how quickly they can get in, or we're going to lose that opportunity to serve that patient. We're also trying to be much more focused on the demands of the consumer when it comes to pricing transparency. I think this is one of the major changes coming in healthcare. And when we think about this in our world, you may go to your dermatologist and the dermatologist may recommend you cut off that mole on your neck. And you say, hey, well, how much is that going to cost me? The dermatologist probably raises their eyebrows, says, I'm not sure. And you don't know because you don't know your insurance plan that well. And you don't actually find out till 60, 90 days later, whether it was $20 or $200. And as consumers, we demand much more from an experience than that situation. And so we're trying to solve that by having more open pricing transparency at the time of the decision within the exam room itself. And I think that's coming very soon with a lot of the EHR, EMR systems. But before it does, we're going to train our staff and we're going to get everybody up to speed on how to tell folks this detail, how to extend this transparency. So becoming more consumer focused is all a part of, in my opinion, going to lead to opportunities to, number one, establish such an excellent experience, but number two, let the business stand out when it comes to competitors. And we live in a pretty competitive space from a skincare perspective, both on the derm and cosmetic side. So that's all really important to us, being very consumer centric.
I can definitely speak to that because as you've been talking, I've been cruising around on the website and it is super consumer friendly. And what are you looking to for just inspiration? This is kind of a newer territory in the healthcare space. Like, what are you looking to for guidance on bringing this transparency into your pricing? Since there's not a lot of people doing this the right way yet, how do you lead your team to be thinking this way in the future?
Yeah, it's a good question. Well, number one, we have a great team here. The entire staff is really sharp. And so folks are bringing ideas all the time to the table. I'd say number two, we're looking at not trying to recreate the wheel, but who are some of the leaders of other industries that have really transformed their space. And so we've got a couple of things that are happening. When you think about the cosmetic side of the business, there's a lot of selling of packages. And so we're starting to look at other models. Can we turn into a subscription-based business and say, hey, we really want you to come get your Botox with us month in, month out, because we think we can provide you the best services and we're willing to start to extend additional offerings to you so that you'll be incentivized to come back, because we know that we can give you incredible care within other areas of the skincare spectrum, both on the elective and non-elective side of things. So we get those ideas from somebody else to say, hey, we think the the world is moving more towards a subscription-based model, and that's something we should trial out and see how it does. And we are doing that, and it's going very well. So we're all not necessarily trying to recreate the wheel, start from scratch. We want to see who's done things really well, pilot in a very organized manner, and then if we see success, start to expand out. So we're doing that and generally not looking at other healthcare groups who have done that, because there aren't a ton out there. We do see some folks from the pricing transparency perspective, a handful of hospital systems and others who have actually published things online and said, hey, here's our pricing. And I think that's going to become more common. We're still a little bit away from that, but we're getting closer to being able to say, hey, here's our medical procedures, and our staff is trained on it. And also here's our cosmetic procedures. And, we're going to get competitive enough to be able to be more transparent there as well.
And I think that some providers are a little nervous about publishing their pricing online. A lot of health systems are. And it's complex because the retail price or the list price is really not what you pay because of the insurance and what the insurance pays. But I do believe that as a consumer, I'm not necessarily always going to pick the lowest price. I don't always pick the lowest price on a lot of things that I want to buy, that I want to make sure there's quality that exists. So it's going to be interesting to see how this plays out. I have no idea how it's going to play out, but it's going to be really interesting to be a technologist and try to assist in this new movement.
Yeah, and I think you're right. It is a balance between pricing and quality. And then the third piece, again, right now, I think that is so important is access. If I have an issue, I'll stay with our industry. If I have eczema that popped up over the weekend and I don't have a dermatologist that I go to all the time, I'm trying to find somebody within my zip code. It can be difficult. I can have to call one place and have to wait for 6 to 10 weeks and call another, and they have an opening tomorrow. So we're trying to get ahead of that to say, let's have convenient solutions available on our website that show our actual providers' availability and some of the expectations for the treatment or for the actual experience, and get that out as far as we can. Can we extend that to Facebook? Can we extend that to the online review reputation sites? How do we advertise about that? Can we advertise? So we're being pretty aggressive when it comes to the marketing and advertising side of things to say, what can we advertise from a medical perspective? What can we bundle and package together? Are there incentives we can put out there? So all those things, I think, come back to consumers are demanding the most convenient and easy experience for them when also considering pricing and quality. So we want to try and tap into all those elements when we're communicating to a potential or an existing patient.
Good deal. So as we've got a few minutes left, as it relates to the future, now we've talked a little bit about, in your perspective, what you think the future will hold. Earlier, you were talking a little about how there's been EHR challenges just because caregivers, they want to focus on what they do best, giving care. You talked a little about how that is changing for the future. Is there anything else that we've not touched on that you think may be coming down the future?
Yeah, well, one of the things that sticks out for me in the future, and just having been in this space for 3 years, is initially I was just struck at how hard it was to find an application or technology solution that was HIPAA compliant, that fit my needs. There really were just few and far between when it comes to specific needs. And now I have been here for 3 years, I can say that's changing very rapidly. You're seeing heavy investment into new technology when it comes to messaging and communications, to automation around the space. A good example is we're trying to figure out the medical claims and insurance submission side of things. And we try to say, well, what would be the best patient experience here? The normal patient experience is I see a doctor, I give them my insurance, I pay my copay, and I get told how much it's going to be 60 to 90 days later. Well, what if we could, instead of sending a paper statement 2-3 times to try and collect on that insurance outstanding balance, what if we could actually just text the patient on the day we know what is covered and not covered by the insurance? And that may be day 7 after their visit. That would be convenient for the patient. It would be more convenient from us from an actual revenue cycle management perspective. So we're able to put some of those best practices in place only because we're seeing vendors come out and solutions come out that are really modern when it comes to their technology stack, and number two, are HIPAA compliant. So we're seeing a lot more opportunity for practices and groups like ourselves to be much more agile and faster moving, trial these technologies, only because we're seeing a heavy investment in the capital side of things from the technology space. So I'd say that's going to continually change the landscape, because you're going to see a lot of adoption on, again, automation and chatbots and more HIPAA compliant communication all across the board. You're seeing that. So for us personally, again, we come back to how do we analyze the customer experience, and where do we find opportunities to trial out some of these solutions? And that's what I'm excited about, is we can really tighten down some of the nuts and bolts. We've got the engine in place. Now it's about optimizing it and tweaking it on some of these open-ended gaps that we can identify.
Well, you've definitely set Sona up to be prepared to do any of that, because you chose the right platform and you've already built the basic infrastructure to be able to carry you and Sona a long way. So it's very exciting.
Yeah, I agree. And again, we're thankful for kind of the core of all this was working with you, Tammy, and with your team to set up that integration, and Sona being such a sales-oriented team on the prospecting and lead side of things. The Salesforce opportunity for us has been phenomenal. And we're excited to see all of the unknowns that come about on where else we can lead, even on bolt-ons to Salesforce and additional reporting, and who knows what's next. So pretty exciting times.
Tanner, thank you so much for taking some of your time, your valuable time, to share with us what is most important right now, what is coming down for the future, and it all comes back to a consumer approach. And you're really not only talking about it, but you're doing it. So thank you so much for sharing not only how you transform this, but how you continue to transform this work in healthcare.
Yeah, thanks, Tanner. We really appreciate it.
Thanks for listening to How I Transform This, Success Stories of Transformation in Healthcare, presented by Versus 12. To learn more about how Versus 12 is best situated to transform the healthcare industry, and to follow along with this show, be sure to visit versus12.com/podcast. We'll see you next time.